The Abdul Latif Jameel Poverty Action Lab. Translating research into action.
Great. Thank you very much, Karen. Can you hear me?
Yeah.
So we're now going to take questions from all of you listening in. We already have a number of questions, so thank you very much. You can continue to submit questions for Karen by clicking on the green bar at the top of your screen, or if you just see the chat box, you can enter in your question there. We may not have time to get to everyone's questions, but I'll try to condense the ones that are coming up that are in common. So first, I'm going to start with a question from Kathy that's wondering about how the conditions were enforced. So what were the methods of enforcement for the conditional cash transfers, and who administered the enforcement?
Yeah, it's a very good question, and so this is actually slightly different for both programs. I'm going to focus on the conditions for related to the outcomes here, so the health and the nutrition. So the two conditions that are key here are the visits to the preventive health checks and are the attendance to the workshops. In the first program I presented at Antonakisis, which is chronologically the second one, so the workshops were it would be the ministry personnel organizing them, and so they would kind of keep track of attendance. More importantly though, for the health checkups, this actually didn't work out very well in terms of coordination between ministries, so between the health ministry and the Ministry of Social Protection, Mi Familia. And so this in fact ended up being a soft condition. So households were told that these cash transfers are conditional on taking your young children to the health centers, but in fact the monitoring didn't work because of the coordination issue. And so in that sense it was a soft condition. So they thought it was monitored, but de facto it wasn't. In the original intervention, so the intervention that started in 2000, that lasted for 3 years, there the government actually had contracted private sector providers for the health component of the intervention, so both for the preventive health checks and for the workshops, and so they were monitored, and of course their payments were conditional on this, and so they had a good reason to monitor, and then the government had a team to kind of make sure that they had data.
Great, thank you. So another question from Alejandro is looking at how to extrapolate the lessons from this study to other places. So what do you think the U.S. could learn from, or other developed countries could learn from the experiences of countries using CCTs? And besides New York City, do you know of any other places in the U.S. or other developed countries that are implementing or currently implementing CCTs?
So I believe Washington, D.C. at least has thought or tried or piloted something. I don't know the details, I must say. And so I don't know, but in a certain, I don't know kind of the exact formula of the CCTs other than in New York City and Washington. In a certain way, the CCTs do have components of other programs, right? So I mentioned quickly the food stamp, which was on one of the slides. The food stamp program to a certain extent has this idea of we're going to label it for food and maybe that makes a difference. Even if that may not necessarily be how we think about it right now. I think the broader lessons that I think here are in terms of the changes in behavior in early childhood, and the idea of kind of working through the parents as opposed to the supply side type of interventions. And I think there is a broader lesson there that should be relevant outside of developing countries, right? So the idea of, we have these type of programs, whether it's conditional cash transfers or not, but in the process, we work with the parents and try to have the behavior change there, as opposed to kind of the supply side preschool or again stimulation by others, or just providing the nutrition. And I think that is something interesting to consider. And so, in fact, if you compare the large literature on early childhood of the different programs in the U.S., the finding sustainable changes, so changes that persist even after the programs, and is relatively difficult, and so our interpretation of is that this is in part because it's kind of the parental involvement that facilitates this sustainability.
Great, thank you, Karen. So we just got a question about cost effectiveness, which is something that JPAL thinks about a lot. So this study demonstrated that the results were significant, but would you consider them to be cost effective relative to other interventions that are trying to get at the same types of outcomes?
Yeah, I think that's a great question. So, and I think in fact, I have this on the slide here. So indeed, when we think of the cost effectiveness of conditional cash transfer programs, the difficulty and the challenge is that these programs change many different things at the same time. And indeed, when we think of, and indeed, in the JPAL comparisons, we think of, okay, well, is this cost effective in terms of just increasing enrollment? And when we look at it, it doesn't look like it, because there is other programs that are targeting and just focusing in kids, on kids enrollment in school that might be cheaper. So, because what these programs do is they have multiple objectives. One of them was improving nutrition and healthcare in early childhood. And so here, this is in fact an outcome. In fact, none of the initial evaluations targeted, even if there is tons of evaluations and conditional cash transfer programs, the initial evaluations weren't measuring cognitive development outcomes, which is why this evidence, I think, is relatively late in the chain of these programs. But it demonstrates how this is an important impact that is there for these type of programs that we need to account for when we do cost benefit. How do we add all these things up? That's a very difficult question. But kind of the benefits here are multidimensional. I think the cost benefit question then of course the question is, if you just want to change early childhood, are CCTs cost effective? And that's kind of why we started looking at these other types of interventions, where we say, what if we only provide information? Do we need to cash? Then we do this more simple, and that's indeed what we're working on.
Great, thank you, Karen. So we have another question looking at conditionality. There's been a lot of attention lately to unconditional cash transfers and some recent research on the effectiveness of unconditional cash transfers. Did you get a sense of whether the behavior was changing because of this conditionality, or would simply having more income affect behavior to a similar extent?
So I think we have relatively strong evidence that it's not just the income, and that's because we have the variation where there is one group that has additional income compared to the other treatment group. So that's in the first evaluation I talked about. And even if they have additional income and they still have additional income 2 years later, their outcomes on cognition are not better. So what I can't say is, after a certain amount of additional income, the marginal benefits are too small to see. That's quite possible, that I don't know. But I think the pattern of evidence we see we see people spending more than we would have expected based on their income level, even their increased income level, on nutrition. So we shift in patterns. And we see these shifts being there after the income is gone, after the transfers are gone, suggests to us that it's not just the income, and that you need what I can't say, I think, based on what I can't say, I'm sure, is it the condition, is it the targeting on the model, is it the social marketing, which is why why we're taking these researches on the forward to kind of tie out these different pieces, to kind of separate out these different pieces to understand the mechanisms.
Great, thank you. So we have someone who's interested in learning about the community development process that happened prior to the intervention. So she'd like to know who introduced the intervention and how were households informed and selected, and who and how were researchers, community workers involved during the course of the study?
Yeah, it's a very good question. So in contrast to many other evaluations you might know, so this was an intervention by the government of Nicaragua. So the main facilitators, the main players were technical staff from the government. That said, so that's kind of at a higher level. That said, as in many of these conditional cash transfer programs, there are local, they call them promoters, so local women that were typically kind of elected on a volunteer type of basis, to be the local intermediaries in the communities and to organize groups of 10, more or less 10 people, beneficiaries together. They would be encouraged to have meetings every week, every other week, to talk about the program, etc., about the objectives. There would also be the person that the ministry would contact when there was any, the new workshop was going to happen. There was a payment day. They're kind of the intermediary. So now, so we actually have another a paper with Renos Vakis where we look at this particular aspect of the first intervention, and we show that this had a very important role. So now, what's key, one of the things that is important is that this intervention targeted 90% of the households in these communities, and that was related to the fact that, first of all, they were very poor communities to begin with, and then it was right after a drought year, so that almost everybody was eligible for the cash transfer program. So we have an intervention where almost everybody benefited, and where then the program, even if they didn't do much kind of community organization mobilization before, during the kind of the rollout of the program, the sign-up of the program, in fact, they asked a woman to volunteer for these promoter kind of leadership positions. So this typically would be women that didn't have much opportunities to take kind of take up leadership positions otherwise, because at least at that time most of the leadership positions would have been men. And so, so we show in this other work that this had a huge kind of positive spillover effect of having these local promotores that themselves are getting the benefits and that encourage and motivate everybody else for the objectives.
Great, thank you. So we've gotten a couple of questions just about the design of conditional cash transfers in general. So there's different sizes of transfers you can do and different lengths of transfers you can do. There's been some evidence saying that very small transfers can be as effective as larger transfers. How much do you think the size of a transfer matters in general for conditional cash transfers?
I mean, indeed, there's kind of, I think there's other work that speaks much better to that than our work in Nicaragua. And I guess, and so that's, I guess that's one part of the answer. But I think more fundamentally, how much it matters is I think it's gonna depend a lot on the outcome we're looking at. And so, when one can see that the size might matter more for kind of leading, if we need, bigger changes. Actually, let me go back to here. No, sorry, here. So if you look at so this is the changes in the nutrition, stimulation, and health during the program and after the program. So the transfers were sizable here. So while they're getting the sizable transfers, not surprisingly, maybe they are investing much more in nutrition to a certain extent, more in early stimulation and health, and that falls down once they don't get any transfers anymore. So to a certain extent, the question, I think, of how much can we get change if with very small transfers, because I think that depends on the type of change we're looking for. Right? So if we're asking households to invest in something, we need something to invest in. If it's an issue about sending the child to school, then the marginal, you might need much less money to achieve that. And so I think that it very much depends on the outcome we're looking at, that we should think of over the long term.
Great, thank you. So this was a study that looked at some innovative questions having to do with conditional cash transfers, and there's been a lot of research on conditional cash transfers. What do you think are the really innovative questions right now in this space, or what are related to conditional cash transfers?
So I think to me the key question is one of the key questions is the long-term impact of this program. So I think there's a lot of skepticism in the policy community about whether they reach their long-term objectives in really increasing human capital. So, lots of evaluations have shown that they are getting kids into school, that they're getting them to the health checkups, the evidence on learning is more mixed. In fact, we have evidence from Nicaragua of the same kind of 10-year half-life relation where we do see significant impacts on learning, and in fact we see impacts on earnings on the labor market too. So this is again with the kind of environmental literature. But other evidence from other countries is much less conclusive. And so I think as we see more and more programs, you know, being there for longer time and potentially having been phased out, this is certainly an important question to look at. Related to that is kind of what are the you know, what to the extent that even in countries that are richer than Nicaragua, we probably don't want people to stay on these programs forever. Then what are the exit strategies? How can we evaluate? You know, what is also a big policy question. So what are the policies to help people exit from these programs, and then we can evaluate it. I mean, I think, the questions about the mechanism, the type of questions you were asking about, or it was asking about the size of the transfer, the targeting of it, etc. They're still there, and I think we're still accumulating the evidence.
Great, thank you. Related to the long-term studies that you mentioned, we actually have a question from someone about how hard it is to track people in these studies for long-term outcomes for over 10 years, or even if you're looking longer than that. And is it very expensive to do that?
Yes, it's very expensive. I casually said we went back 10 years later. So the reality of it is we spent 2 years tracking these people. So in fact, it was between 2009 and 2011, and we tracked them all over Nicaragua and to Costa Rica. So is it difficult? Yes. I mean, and that is because at least in this setting, but definitely in many settings, these populations are very mobile, right? So there's a lot of regional migration, temporal migration, people moving in search for opportunities, coming back. So that requires, for instance, going between Christmas and New Year when they might be visiting. It requires using cell phones smartly, etc. So that said, and I think, and clearly that there is a cost to that. I think in this particular case, because this is one of the only interventions that, first of all, that has been there that had been there 10 years ago, but also an intervention that stopped and that has this variation based on the randomization that we can still exploit 10 years later, that this was actually worth it. Because again, this is the main objective of these programs was to do that. It is a question that is hard to answer. And so being able to, so for most of these programs it's difficult because, for instance, in Mexico, in the famous case, the households started getting the intervention in 1997, but soon afterwards, the control in 2000. So the two, if we go back to them in 2015, the difference between 15 years of exposure, 18 years of exposure, it might be hard to see long-term impacts. And so given that we had a unique opportunity in Nicaragua to look at the long-term question, that is why we thought, and why I guess the donors thought, this was worth the investment.
Great, thank you. Looks like we have time for a couple more questions, so if you still have them, please write them in through the chat box. The next question is, how do you think these results compare to other studies in early childhood development? And in particular, how would these compare to Paul Gertler's evaluation of early childhood stimulation in Jamaica, if you're familiar with that study?
Yeah, I don't think of it as, yes, the study in Jamaica is the study that I just referred to by Sally Graham McDaniel, where indeed Paul Gertler was involved, Paul Gertler and and a bunch of other people, on the long-term impact on the labor market results. So so what these interventions, and so those interventions, that's exactly what I was talking about that are being subsequently tried in Colombia and Peru, etc. So those are much more similar to the last part that I talked about. So so where you train a professional or an educator or facilitator to go do home visits, to work with parents and children to talk about the different aspects of early childhood. So as I said, so kind of this is relatively similar. I think the difference with what we did and what Sally has been involved in designing in many places the big difference was the focus on or the variation on focusing on the fathers, where I think kind of the traditional approach in most of the, not just this work, but almost everywhere, is kind of focusing mostly on the models because that's the natural agent for change there. And I guess the other part was that we worked in this case with a local, so with local experts in Nicaragua to have a curriculum that was focused on the key challenges there. So for instance, the delays in language are, I mean, while they are there in the region, I think they're particularly severe in Nicaragua, and so we decided to kind of have a curriculum that's focused on this specific.
Great, thank you. So I think we're going to go to our last question from Justin, and this is about spillover effects. So given potential positive spillover effects for an entire community, has there ever been any consideration or past studies expanding conditions to a group of families or community rather than targeting this intervention at the individual level or individual household level?
It's a good question. So I think the short answer is no. I think the longer answer is, to a certain extent, that is a little bit this idea of the promotores. Right? So I mean, all the families are responsible for sending their own children to school, but those local promotores are kind of, I mean, again, this is not a hard conditionality, but they're kind of setting, you're responsible for people making people comply with the rules to provide them information, etc. So to a certain extent, I think that's a little bit the idea of the community, to shifting the community equilibrium is important here, and indeed, you know, both our work that I was referring to, also some of the work of Horacio Atanasio on the Columbia program suggests, and more of the qualitative work in Professor Pinales, in fact, has suggested the key role that these promotores play, which is consistent with kind of a community level enforcement mechanism, enforcement of conditionality.
Great, thank you so much, Karen. Unfortunately, that's all the time we have. I'd like to thank Karen so much for sharing her research and her co-author's research today, and then all of you joining in and for sending in your questions. Those were great questions today. For anyone you know who missed the presentation and may be interested, we do record these and we'll post them to our YouTube channel in the coming weeks. And if you have any feedback on the webinar, we'd love to hear it. You can share that via email at webinar@povertyactionlab.org. Thank you so much for joining, and we hope to see you again for another one of these research webinars. Thank you, Karen.
Thank you.